data, as we of course are connected with, and community indicators, but more importantly, using that to guide action. So she talked about activists and people taking action. Place-based funders are a major source of action in local communities, and I believe that's what we're focusing on today, is place-based funders that are using data to take action, to guide their action toward a better community. Specifically, she also mentioned the importance of drilling down into neighborhoods, not just looking at the state level, but also really getting to see what's happening in neighborhoods of different communities. And community foundations and place-based funders are very well situated to do that. So I'm delighted to share with you that we have an excellent lineup today. We're going to start off with a presentation in a few minutes that takes more of a national view of, and that will be delivered by Patsy Krager and Rhonda Phillips. And they'll be talking about indicators of well-being across U.S. community foundations. So really bringing that theme home of community foundations and other place-based funders as being places where mapping of indicators has a great home in that it connects the data with the action. Then we'll follow up with a presentation at 1:30, which is a panel. And it's a panel with some great presenters. We've got Mendy Blue Paca from Fairfield Community Foundation, Aimee Cambronero from Minneapolis, the Community Foundation, and Rubai Estes from Santa Barbara Foundation, and they'll be talking about data-driven philanthropy in their local communities. So that will be an excellent panel, and we'll have plenty of time for questions and conversations. That will be followed at 2 p.m. with Don Matson and from the Peter and Elizabeth Tower Foundation, and he will be joined by a colleague. They will be talking about finding and creating better community indicators for intellectual disabilities, learning disabilities, mental health, and substance use disorders. Then we'll be followed by Nancy Anthony from Oklahoma City Community Foundation and Josh Yates from Thriving Cities, who will talk about their work. Then at 2:30, we have a slight switch up. Diana Zarzuelo was going to be presenting from Greater Houston Community Foundation on using data to drive drive philanthropy during COVID-19, and Nadia Villani will be presenting in her stead. So we're looking forward to that at 2:30. Then we have some time for questions and answers before shifting gears. And continuing that shift of gears and continuing on that theme of using data for place-based funders during a period of COVID-19. We have a 3 p.m. talk by Tom Kelly and Nick Redding from Hawaii Community Foundation on using synthetic community modeling data to plan COVID relief recovery. Then followed by I'll present on the Central New York Community Foundation's work using data in real-time COVID response. And then we'll move toward the closing of our session with Catherine Pettit from the Urban Institute, talking about investing in data capacity for community change, which has really been a theme throughout this entire track. So we're looking forward to all of these wonderful presentations. We also will have a Q&A time at 3:45. And I believe if there are no questions, we will get ready to jump right into our first presentation, which starts at 1:10, and that would be in less than a minute. So Patsy and Rhonda, are you there? I think I saw Rhonda earlier. You can go ahead and turn your video on and start sharing your slides.
Nonprofit and government or the same thing I do. My first slide, wonderful. So I thought I'd just start very quickly by orienting everyone to the work that our foundation does. So in January 2018, we actually released a new strategic plan, which takes us through the end of 2021. So we're going to start strategic planning again soon, though I think we'll be tweaking more than overhauling our plan. And so we defined an overarching strategic goal, which was to close the opportunity gap in the county. And there are many, which I'll get into in a bit. And so we appreciate that, that's a long-term and an ambitious goal. But all of our efforts now at the foundation are really oriented around that guiding light. So for a little context about Fairfield County, Connecticut, for those who don't know, it is the county that borders New York City, and it's the southernmost county in Connecticut. And unfortunately, we have the dubious distinction of having the highest income inequality among all the largest metro areas of the United States. So we rank first on that metric, which is not something we're proud of, but certainly gives us, as a community foundation, a lot to focus on. So as a result of that, we know that a quality education, safe neighborhoods, stable housing, the ability to earn a living wage are outside the reach of many in our county. And so that is why we are so focused on using that singular data point around income inequality to define our work. So we strategically invest in initiatives that serve three primary populations, and the first are youth and young adults, ages 16 to 25, as you see here. We also focus on women and girls and immigrants. And again, these focal populations were selected for data-driven reasons. We commission and gather and analyze research on a regular basis to look at how outcomes are progressing for these populations and the outcomes we're seeking to achieve. And armed with this data, we think that's what enables us to make strategic investment decisions, as well as tweak our strategies as we learn new and relevant information. So I'll take a few minutes to highlight some of the data. And unfortunately, my screen went blank. I hope that didn't happen for everyone. Did it happen for everyone? Oh boy. Oh, there we go. Well, I'll talk a little bit about some of the strategies that, or the data that informs our strategies. So in Fairfield County, our population is becoming far more racially diverse, particularly among children and young adults. So just as a point of reference, in 2010, our population under 17 was 40% children of color. And in 2017, that figure rose to 45%. And we suspect the next time that we capture this data, it will probably rise again. And so given these changing demographics, we have to think really critically about how every decision that we make impacts racial equity. And our foundation has, as of our most recent strategic plan that I referenced, committed to implementing values of diversity, equity, and inclusion broadly. But more recently, we've really adopted a much more explicit focus on the role of race as a driver of outcomes. So over nearly 30 years, the immigrant population in the county has increased by 104%, which is a tremendous increase, right? And so that increase has largely been concentrated in the county's cities. In Connecticut, in our Fairfield County, those cities are Danbury, Bridgeport, Stamford, and Norwalk. And in those cities, the immigrant population has actually increased by more than 120%, as compared to some of the suburban towns where it's increased at a slightly less rapid pace. So given this changing demographic, we've chosen to invest in support for immigrants and immigrant communities, as well as another sort of targeted area for us. And last summer, the foundation launched an immigrant support fund to improve the educational, economic, social, legal, and health outcomes of immigrants and immigrant families. So just another example of how the data has really formed our strategy. We don't only use data, however, to inform our focal populations, as I just shared, but we also use it to inform our organizational strategies and the results that we are seeking to achieve for any given population. So looking again at youth and young adults, one of our desired results is that all Fairfield County youth and young adults have training and credentials that lead to meaningful career opportunities. And so another desired result is that all Fairfield County students graduate with a high school degree and are prepared for post-secondary education and employment. And we really take a broad definition of what post-secondary education looks like, but we do firmly believe that in this economy, everyone needs at least some type of credential or 2-year degree or 4-year degree or certificate beyond high school. So this chart shows some of the key data that informs our work around these goals. And as you can see, although high school graduation and college enrollment rates are relatively high, less than 2/3 of high school graduates have actually obtained a college degree 6 years after high school. And what adds to this picture are the remediation rates for Fairfield County students. And so, as many may know, but I'll just orient us to what remediation rates are. It's the percentage of students enrolled in college who have to take non-credit bearing preparatory courses within their first 2 years in higher ed. And so for the most recent years for which we have data, we see that the remediation rates for students who attend Connecticut state colleges and universities vary really significantly by zip code. For example, in some wealthy suburbs like Wilton, Westport, Connecticut, we see rates like 21% and 49% respectively of students requiring remediation. But if we shift to the state's largest urban city, which is Bridgeport, Connecticut, nearly 80% of high school graduates will require that type of remediation in higher education. And so the reason we really focus in on this data is because we know that remediation adds to the financial burden for students, often exhausting their available resources prematurely, and that can be a real obstacle to degree attainment. This data also serves as proof that we need to continue to fund and partner with organizations working to provide educational services for youth and young adults to ensure that we're actually preparing them to enter the workforce. And then last but not least, one of our other key organizational goals is to increase economic opportunity, and particularly by ensuring that there's greater access to affordable housing. So affordable housing is a real crisis in our region. And as you can see, nearly 40% of all households in Fairfield County are cost burdened, meaning at least 30% of their household income is spent on housing. And renters are especially cost burdened, as you see on the chart here. And then 51% of Fairfield County renters are cost burdened, and another 28% are severely cost burdened, meaning that more than half of their income goes towards housing. So at our community foundation, we've really oriented a significant amount of our funding, our advocacy efforts, our community leadership work to address this affordable housing crisis. And those are a couple areas, not all the areas that we focus on when we say we're aiming to close the opportunity gap, but I thought I would highlight those as ways to demonstrate just a snapshot of how we use data to inform our work and how we're putting the data that we commission into action.
Thank you very much. It's so fantastic, at least for me, someone who looks at data so often, then to see that data to action put right into play right here. So thank you, Mendy, and it's great to hear what Fairfield is doing. Now we'll move on to our next presenter, Amy Cambronero from Minneapolis Community Foundation.
Great, thanks, and thanks for having us here. Are you able to see my screen?
It has not shifted yet. If you go to screen on the top and start sharing screen, is that what you did?
Let me try this again.
It's right next to the video camera.
Yes.
It's changing. It's loading. Good. I myself am, yep, there we are. Perfect.
Okay, wonderful, great. And thanks for the invitation to speak. It's great to be here with you. As Frank said, my name is Amy Cambronero. I'm the Director of Learning Evaluation and Research at the Minneapolis Foundation. As can be assumed by the title of our organization, we are a community foundation based in Minneapolis, Minnesota. We've been around since 1915. I have only been part of the organization for 3 of those years. And since I've joined the foundation, we have really shifted the way that we are thinking about our work, really shifting from what I would consider a theory of change to more of a theory of philanthropy. So what I'll present to you in the next couple minutes is an overview of kind of our thinking, where we are, and then examples of the work. So let me see. So as I mentioned, we've been around since 1915, and when I first started, I started looking at all the documentation, and equity has really been a part of a lot of the work that we have been doing for at least the past decade, if not more. We've established a lot of partnerships to do research, to do work focused around equity. So we've partnered with the University of Minnesota to publish reports and analyze data on immigrants and refugees, new populations coming to Minnesota. We've partnered with a local research institution, Wilder Research, to dig into the census data, the American Community Surveys data, to produce reports that we hoped that our nonprofits and community members would utilize. We partner with government on the census. We partner with the state demographer's office, as well as private institutions to really, I guess, engage and utilize the existing knowledge, expertise, and resources that we have in the community. As we did this, we kind of had a couple like starts and stops, right? We focused a lot on research, then we shifted to more of the analysis of the community level data. And as we started talking about our work, a lot of the efforts have really focused on grant making. And so as we started a new strategic framework and a new shift in thinking, we wanted to really highlight that as a community foundation, we are not just grant makers. We have a lot of additive activities. We call them levers that we wanted to make sure that was lifted in our work. And so you'll see that in the next couple of slides, that in addition to grant making, we also do advocacy. We do convenings, and we're calling them learning collectives. We do research. We do a lot of different things. We partner with government, with private. And so we're looking at ways to really highlight that in the new strategic framework. We also recognize that we operate in a much broader ecosystem. So our old strategic framework focused a lot on the counts. It focused on the number of quality seats of education that we are able to produce. We counted the number of people who are trained and how long they have been in that job. But we also realized that we are part of a larger and bigger ecosystem. And how do we start acknowledging and identifying really what we're able to contribute and how those other levers or those other activities actually contribute to that community shift that we so passionately work to change and make a more equitable community. So that really got us to thinking about shifting from that theory of change to more of a theory of philanthropy. And so when I say that, I'm going to highlight 2 examples of the work where we have been operating historically for a long time, but really bringing attention over the last years, and then also giving examples of how, given the recent events, both in Minnesota and nationally with regards to the COVID pandemic, and then also George Floyd, how we are using those responsive approaches to bring more equitable solutions and how that fits with our overall framework. So this is on our website. We have an initiative called Reimagine Education, where, as you can see, we're highlighting key levers which we aim to focus and put our attention towards over the next 3 years. Our strategic framework runs through 2030, but we are taking pauses every 3 years where we look towards the community level data to determine whether or not we're making and seeing the shifts. As I mentioned, we have great partners in Minnesota. We use Minnesota Compass as kind of our guiding light, who they got a great dashboard and are a great partnership. So we really look to them and those resources. We also look to the University of Minnesota to commission research in some of the knowledge and education gaps. But internally, our focus has really been on are these levers, the learning collectives, the research, the grant making, the co-investment, the partnership, the advocacy, things that we control, are they making a difference? And if so, we would expect to see the changes happen through relationships and as the levels of control go further and further from the foundation. So this is an example of our education work. Again, we brought students, parents, teachers, administrators together for a convening. We commissioned research. We do grant making and invite our donors to give in those areas as well. Co-investment with other funders. Partnerships, again, looking at the government and also other key stakeholders, and then using our advocacy lens as well. Criminal justice, again, looking at the death of George Floyd, we already had a responsive collective fund where donors and other grant maker or philanthropic entities are able to give. So there's a fund for safer communities where we're getting that money out into the community. In addition, we have a podcast. Sometimes people are like, why do you have a podcast? We have a podcast that focuses on race and equity. And it brings together actually a lot of families' voices that have been affected by violence. For example, we had one of the Central Park Five, Yusuf Salam was on one of our live conversations. So that's just it's an opportunity to bring our donors and community closer together, and it fits under this larger frame. Again, we're engaged in advocacy and policy, and I've also commissioned research. Our One Minneapolis Fund, which is our collective impact fund, also fits under our new framework. And so this, again, we separated them into two. Again, these are emerging issues. So the the pandemic response in phase 1 that went to nonprofits who, as we all know, experienced a lot of increased needing to shift their program, their services, funding, all of that. That's where the funds went, as well as rebuilding, which really focused on the healing and community level work that's happening in our communities to address, heal, and then also now rebuild. Recognizing the infrastructure is also important. So I share these because this is a different way of thinking about our work, but also recognizing that there's different layers of data. So we certainly, every 3 years, we check in at the community level to make sure are we making the progress that we expect to make, in addition to complementing that with our internal surveys, our internal reflections, our internal feedback loop that we have with the community. And we certainly look to community to both check us in some ways to make sure that we're interpreting the information correctly, that we are being as responsive and playing the right role. And also looking to them to help inform where we should go moving forward. So it's a little different, but it's exciting to be in this work. So thank you again.
Thank you, Aimee. And certainly, many of these issues they've talked about are things that are reverberating across the nation. Again, as Angela Glover Blackwell pointed out, the awakening that, some of the events in Minneapolis brought to people about day-to-day life in their own home communities. So it's great to see what you're doing and how you're working on that. So thank you. On to our next presenter, Rubai Estes from Santa Barbara Foundation. So please go ahead.
Hi, so you can see my slides, I think, at this point, a cover page? No.
Yes.
Thank you. So I'm looking forward to meeting all of you in person one of these days, but until then, hi, over fiber optics. I have a wonderful team that helps inform all of our work, so I wanted to acknowledge them and also some of the partner organizations that really help this piece that I'm going to present possible, which is Santa Barbara County's Resourcing Referral and Child Care Planning Council. Today's conversation is going to be at a much more of a micro level than what Mindy and Aimee were presenting today, and it's just so impressive to see these community foundations evolve and be so relevant in our communities. You may not be familiar with the Santa Barbara Foundation, so the mission of the foundation is to mobilize collective wisdom and philanthropic capital to build empathetic, inclusive, and resilient communities. I do want to share our charge, and this is similar to Mindy's organization, Fairfield. We adopted a strategic plan in 2018. It's a 5-year strategic plan. We also are a high income and quality county, and our workforce will be a majority of color once this 2020 census is completed. And racial inequity is one of the highest challenges in Santa Barbara County. Our charge is to hold a safety net for the most vulnerable. And this primary tool for this is grant making for food, safety and shelter, access to primary and behavioral health. We also stand up for our working families, and this is where you will find our work in access to quality childcare, workforce development, and workforce housing. And similar to our other foundations here today, we support our social sector through what we call the Collaboration for Social Impact. Lastly, our response to the COVID-19 pandemic really reaffirmed the importance of all of these areas as part of our response, recovery, and rebuilding. So today's focus is on childcare and how we inform some of those decisions using secondary data. And the overview in Santa Barbara County, for example, is that a family with one infant and one preschooler could spend about 34% of their income on that childcare and early care and education, about 41% of their income towards housing, leaving very little to cover for food, clothing, or car payments or healthcare. So as you know, this is that check to check scenario. One accident or one loss of income can really create housing insecurity for our families. Before COVID-19, we only had half the child care slots available in our county for children ages 0 to 12. And we actually have data now of how much worse that is as people begin to return to work. And if we have time, we can talk about that strategy. So at the Santa Barbara Foundation, we believe that childcare is a basic need for our working families to lead safe, healthy, and thriving lives. And for this effort, our toolbox includes advocacy, childcare scholarships, grants, leadership support, and also investment in our workforce. So this is a very simple story of caring. In the 90s, the California state welfare system impacted subsidized childcare. We had a generous donor, William Bill Daniel, acknowledge this change and partner with the Santa Barbara Foundation. He created a field of interest fund in honor of his late wife, Lottie, and donated $1 million to the Santa Barbara Foundation to provide child care subsidies for the workforce. We grant approximately $300,000 a year. So the scholarships require a parent contribution, and that can range from 5% to 50% of cost, depending on the type of care provided and the family income level. And as you know, the workforce income level can vary from barely out of poverty all the way to low moderate income. And this is dependent also on the age of the child, the parent contribution. We are a quality county where quality counts, so quality improvement pathways are important. And of course, each community's need. We vary from, we have about from ag to some suburban neighborhoods. So how do we make these decisions when the need is so broad on who receives these scholarships? So first and foremost, we receive these grant proposals from child care centers. All of them provide pertinent information. So they'll give us what they don't, make sure we meet the donor desires, that they serve families that are in the workforce. They collect site-specific information and where they are in their pathway to quality and who they serve, such as family profiles. Every county in California has a state mandate child care planning council. And the planning council is charged with doing a needs assessment, which is a holistic needs assessment by community, but also very specifically for low-income families by zip code. So this is where we pull some of our demographic data for each group, infant, toddler, preschool, school age, who qualify for subsidized care and identify where those gaps are. They supply, the state also requires them to do the needs assessment, which is actually quite thorough, and they survey a number of providers, licensed exempt providers and licensed providers in Santa Barbara County, and they look at birth rate, school age access, and where those gaps are. So whenever possible, the data is gathered at that community level, which is a zip code, but in some cases it's just countywide. Now, that isn't enough to inform exactly where these childcare needs are. We also work with the first 5 data that we can collect for quality pathway. We don't penalize organizations because of if they have achieved high quality childcare, but we also, I think there's a separate set of screen. Let me try that again.
I think the other presentation started sharing. So that's good to know that they'll be able to share when it's time. But yes, perfect. There we go.
I don't know how much we missed. I was staring at the screen.
It was just that. It was all we missed, that one slide.
So this one is just quality pathways, and we want to know that that these organizations are on their journey. As you know, childcare providers can be very simple settings, all the way up to sophisticated corporate childcare centers. We also work closely with family service agencies. These are all across the country, many of which, if not house childcare, they know the families that are our priority populations. So we make sure that we're triangulating zip code and needs assessment data with these 2 other interactions and relationships. This is just a snapshot of the needs assessment by the Child Care Planning Council and then the zip codes. I was trying to figure out how to show our analysis. So this is just a big spreadsheet. The mapping is just for your pleasure. We don't actually geolocate them, but we do use a spreadsheet by zip code to make sure that we're being equitable. Our workforce is varied, but the discrepancies in availability of services by race is just rampant. So it's really important that we focus on communities of color. Our grant portfolio could look something like this: a large number of school-age children because the costs are less. Infant care can cost as much as $1,600 a month. And in the interest of time, I'll glance over this. We know what the impact is going to be of reopening. So we are altering our strategies to be able to be there for our childcare providers in many different facets, including business development, navigating reopening, and also going back to do an analysis of 990s in a very different way, using algorithms and a specially built taxonomy around potential childcare providers so that we can come back to the capacity to at least get to half the community as we did before, if not more, to get our workforce happy and healthy back to work. That's all I have.
Thank you, Rubai. It's good to see work data being collected by one group, then being used to direct foundation work and to be very responsive. When I first heard about you targeting zip codes by childcare needs for your grant making, it really impressed me. So thank you to each of our presenters. We do have time. We have a couple minutes. It's been close to 28 minutes. If anyone wants to post a question in the Q&A, please do so. I don't see any yet. But it did strike me that each of you are doing very different things in your communities. But when I think of my own community, we have all of the same issues. We have, I think of Fairfield, we have income inequality in where I am, Syracuse, at the Central New York Community Foundation. One zip code over is a complete night and day difference. And so focusing on affordable housing is something that we're also becoming more interested in, particularly lead-safe affordable housing. By us, the housing that is safe is not affordable, and the housing that's affordable is not safe. So, that certainly that's there. And of course, Amy, as you're talking about Minneapolis and the theory of change, I know from past conversations, that you're looking at prison populations and stuff. That's something that we're looking at as well, because that like many places across the U.S., we've had. Certainly, tensions between police and residents, and and how do we begin to move forward and rebuild something better? So indicators are important for how we know whether or not we're moving. And of course, Rubai, childcare is big for us. We have an Early Childhood Alliance that is really doing a lot of work in this area. But your method of targeting really, really could help us. So we do have a question now that's come in from Susan Brucey. Does your focused work lead to opportunities for more leveraging of efforts and resources? So anyone can answer that, but there it is. I don't know if you see it on the side there. Does your focused work lead to opportunities for more leveraging of efforts and resources?
I'll share a little. This has more to do with the other funders that we work with. As a community foundation, we have the ability to mobilize private funders. So the more data we collect, because we have that capacity in-house, we're able to leverage this data to inform grant making. In our case, with COVID-19, about 31 different funders, foundations.
Thank you. Thank you. I have another question. Has anyone looked, and this is one from Rhonda Phillips, has anyone looked at the model of linking to elder care and childcare? There's some good models in Nordic countries for this.
I'll be quick. We have a community caregivers initiative as well. And we haven't found the similarities. So I look forward to exploring the Nordic countries models, because we do have them running in parallel at this point, recognizing that both are caregivers. One is looking at those who are paid, and the other, those who are not paid.
Thank you. So because of timing here, we are tight, but we do have a question and answer period coming up within the hour. So there'll be time to circle back to these and other presentations. And so please don't go anywhere. If you have more questions, you can pop them in the Q&A. And I want to thank our presenters. Thank you, Mandy. Thank you, Aimee. Thank you, Rubai. These are certainly presentations and work that I'm going to continue to consider as we continue to evolve our work in Central New York. So thank you. Okay, for the sake of time and to try to keep on schedule, now we'll do the 110 presentation. Patsy and Rhonda, are you able to project your screen and to share your video? Okay, we're seeing the conclusion now. So it looks like, yep. There we are. Okay, so we welcome Patsy Krager from Georgia Southern University and Rhonda Phillips from Purdue University. Can you just double check that it looks like your microphones are on? Patsy, are you there? Rhonda, are you there?
So I'm the one who uploaded the slides, so I'm not sure if they are. Rhonda said she keeps being looked out of the webinar. But she's also shows that she's on the phone, so if you can speak, I can advance her slides.
Yeah, I'm seeing Rhonda down there, not her face, just her.
Yeah, that's been on all the time. I don't know what's going on there. That is unfortunately the one thing that we need to be expecting with the technology. So. Rhonda, if you are there, did you call in or can you call in? We can't hear you.
Hello?
Oh, there we are.
Hello?
Hello, can you hear me okay now? I'm on the phone, but I'm getting a lot of echo. I'm so sorry because I can hear everyone else and I've been enjoying the presentations. And it says that my microphone is on, but as long as the phone works, we'll just continue forward with this. Can you hear me okay?
We can.
We can, but you need to unmute you. Sorry, to mute your computer then if you're on the phone.
Okay. Hold on. It doesn't give me that choice. It says camera or dial in, and there's no microphone. I'm afraid if I mute it, it's going to make slides go away.
Can you turn off the sound on your computer and just take the sound from your phone?
Yeah. Let me do that. Okay, that's probably much better now.
Yes, much better. Thank you.
Okay, great. So sorry for this. It worked just fine earlier and just kept throwing me out. Not sure why. But I really did appreciate the panel and listening to what you're doing with your community foundations. It's really inspiring work. So thank you for that. Patsy Krager, my colleague, couldn't be with us today, so she asked me to be the voice. And I did record a presentation on it, but the software wasn't compatible, so we'll just have me going through this at this point. And Frank, you keep me on time and so that I don't go over. Anyway, if we could advance to the next slide. Let's see, I can figure out how to do this myself. Let's see. Yeah, there we go. This is the framework that we're looking at. We have a couple of things that we're trying to do with this. Mostly, we're trying to look at what the U.S. community foundations are doing in terms of community and community well-being indicators. There are basically around 828 community foundations in the U.S. These are the ones with some national standards and accreditation. And so those are what we're looking at. And so the frame that we're looking at is basically the idea that community foundations are much like community development organizations. They're involved in trying to solve solutions or provide solutions to local problems and issues and challenges. And so what we did is we looked at the Community Foundations National Standards Board and pulled out some things that sounded a lot like community development and community well-being efforts. And so that's how we started with our basic framework. And then we basically looked at this idea of community foundations as place-based, much like community development organizations are as well. And we just give some definitions here on this slide. I feel like I'm trying to talk to those who know far more about community foundations than Patsy or I ever will. But this is the sort of the standards that you look at when you're looking at definitions and other things, that they're philanthropic organizations and are hoping to make an impact on the issues they care about, both the foundations and their communities. And so there's some common characteristics there on the slide that you can see. Community engagement is the one that keeps coming up over and over again, and that's really important. We're going to circle back to that later when we talk a little bit more about the relationship to community well-being. And this is just an FYI. This is, community foundation numbers. In North America, as I said, there are 828 in the U.S. The rest are coming from Canada and Mexico. And then we have them scattered throughout the globe. Europe is another big area where community foundations play a role. And then you can see it goes down much further. There's only 12 that we could find in South America, for example. Probably will increase given the current situation we have with the pandemic and with the calls for more social justice. And so there may be more increased interest in this as we go forward. But it was just an FYI. This next slide is U.S. foundations giving over time. Put it for all private foundations. As you know, there's a lot more private foundations than there are community foundations, and just wanted to compare it. And looking at this timeline of about 5-6 years, it's been increasing. It runs about 10%, sometimes 11 or 12% of what private foundations do, but it's been steadily increasing a little bit since 2013, which we take as a good sign that there's more activity and more involvement with our community foundations. This next slide is the top 10 community foundations by asset size. So we weren't looking for anything else by programmatic or by impact or performance indicators, which we'll do later in our study. But we were just simply taking the asset size, and not surprisingly, Silicon Valley has the largest amount of assets. And then you can see some other examples. Some are city-based, some are metropolitan area-based, some are state-based, and then they give to their locales within their state. And this is just a total of, the 27 billion just of the top 10. So it's just an interesting way to sort of look at what was happening with Community Foundation's assets. So here's where we shift gears a little bit and talk about expectations. There's this underlying sort of ethos of community foundations, from what we can glean and gather, is that they are striving to improve place-based quality of life and by extension, community well-being for those community members. And so it's also, in looking at the literature, it's pretty clear that there has to be some type of participation by the resident citizen stakeholders of those communities, or otherwise it's maybe not likely to quite address what they need or what they want. There's also something I wanted to point out on this slide, community change initiatives. I think one of your panelists just mentioned that they're not so much looking at community change as they are a philanthropy, theory of philanthropy. But there is something called community change initiatives, and this is basically very place-based or focused on a particular area where they're trying to make something happen, whatever that may be. You know, if it's increasing job skill training or providing more childcare, whatever it may be. And so the CCIs are something that pop up quite a bit when you're looking at the literature around community foundations, and there's a definition of that given on the last part of that slide. And then challenges in living up to expectations, and this is just coming from my colleague Patsy has done some reviews of and interviews of community-based foundations throughout the U.S., and some of this is based on her observations and interviews, but also looking at the literature in community foundations, that there's been sort of this, I guess, assessment that they have not lived up entirely to the transformative expectations of what they were intended to do or have the way they were designed. Now, that would not be the case listening to the panel today. In fact, they sound like very inspiring work is happening. But this is just pulling from the literature. And a couple of reasons for that. One, the lack of clarity around goals and vision and aligning that to the mission for their foundation. And then building effective relationships with grantees and other local partners, that ever important community relationship building. That's an aspect of community development that is what we call a foundational aspect. And so there may be some opportunities for learning together with community development organizations as well as community foundation. And then population level impacts have not been at the scale that that we'd like to see or that was expected. And there's a lot of reasons for that, not the least of which are the limited resources and access. We just can't solve every single problem, and they're overwhelming if you take the whole of needs. And I remember someone telling me this years and years ago when I was a student, that if you look at all the needs in your community, you'll never be able to address them. But if you look at those that you can build on and try to turn it into an asset, then that's a much better approach to trying to solve some of the challenges that face our societies. And then the same thing with community foundations. But there will never probably be enough to address and to fund every single issue and need. So part of it is just the nature of what we do in community work. It's not anyone's particular fault. It's just the way that it plays out in community. So our study, again, this is a conceptualization. We haven't collected all of our data yet, but what we were looking at predominantly was to what extent and what ways are community foundations aligned and working together for addressing community issues. And then also we wanted to explore, by looking at community foundations, by correlating community indicators to 4 of the National Community Foundation Standards. And I'll talk in a moment about why we only selected 4. The rationale for the study is that we don't know too much other than some of the case studies that exist in the literature and some of the theoretical constructs, but we don't know about the overall strategic direction of community foundations in actively engaging communities. And there again is that ever important aspect of community engagement. Again, that's a foundational concept within community development research and practice, but it also, pops up again and again when we're looking at community foundations, because without that engagement component, it would be very difficult to move forward on many challenges and fronts. And so we wanted to look at those foundations that were accredited by the U.S. Community Foundation's National Standards Program. And we wanted to pull out those that reflect community engagement. And we're going to go predominantly after performance indicators, and I'll talk in a moment about those as well. Frank, how am I doing on time? Do I need to slow down, speed up, or how am I? Since I totally blew the first part. Are you there? Hello?
Yeah, sorry, I was on mute. You bet not.
Oh
you,
gosh, that scared me. I'm like, oh
you,
no, now the phone is throwing me off. Am I okay on time?
you have 10 minutes remaining.
Okay. So I may speed the pace a little bit because I've got a lot of things to go to. Okay, so you're probably already familiar with the national standards for U.S. community foundations. It's their accrediting program. So I'll leave you to read those. It's just basically information, and there's a link for later if you want to circle back to that. The national standards for U.S. community foundations in this next slide, we selected for Standard 2, 18, 19, and 24. And the reason that we pulled those four out to correlate with our community indicators is that all of these have some component of direct engagement, directly being involved in the community. Some of the other standards didn't really apply or hold relevance for those contexts of community development and community well-being. So the next slide, we talked briefly about the importance, and as noted, they all engage in some dimension that was interesting to us when we're putting on the viewpoint of community indicators for community development and well-being. Those are the four that kept popping up over and over again as we went through the data. And we hope that what we can do by combining these, that we can get at a culture of community shared responsibility, particularly with participation. And I have to make just a side note here. A lot of times we see it called citizen participation in the literature, and that's what was used for many decades. It's actually probably better to say just participation or resident or stakeholder or citizen or all three at one time, because not everyone is a citizen per se, but they're members of that community, and so it needs a bit of a broader framing there. Okay, the community indicators measuring community well-being and quality of life. So this just gives you a little bit of information about what community indicators are. I mean, that's been around for a while, so we all pretty much can recognize one when we see them. But the thing I want to point out about this is that measuring quality of life is the really tough part of this. And to a large extent, measuring community well-being is much the same. There's a lot of different perspectives brought into the fray when you try to parse through how to measure that and who is valuing what, because again, it has values embedded in that. So that's the part that's a little bit more shaky than others, is that it's a little bit more difficult to find those hard and fast indicators where we can really do this. There's been a lot of good work done in recent years on this, so it may be getting a little easier than we've had in the past. And I wanted to say just briefly about community flourishing. Flourishing is another word for well-being, and it really looks at all aspects of a community's life, and it would need both objective and subjective indicators. And so we'll talk about that again in a moment here. So we're looking at measuring community change with these indicators. Again, not the easiest thing to do, but we can try to pull out enough of them that we can look at what the impacts have been. And so again, this is just a little bit more about what we're doing here with the study itself. And then the criteria for selecting successful indicators, just wanted to include that because we are an indicator conference after all. Again, some of these have been recognized for a while, and we just wanted to point out again that having validity is always important. Some of these may change and come and go, like measurability. There's some data that you just can't get, and so you have to either do proxy measures or think of other ways to get at what you're trying to seek. The same thing with comparability. You want to make sure that we have enough to compare communities, and so that's going to be some of our biggest challenges in this study are those three that I just pointed out within our indicators when we go into the data more. This is types and scales of community indicators. There's both systems and performance. I'm not going to go knee deep into this. We can share a presentation with whoever is interested. This was more, I guess, the background information on different indicators. There's subjective performance dimensions I mentioned. Vanderweel recently has a conceptual framework to look at subjective well-being at the national level, but the way that he formulated his study and his framework can also be applied at the local community level. So we're actually going to be using a lot from his framework, and we've pulled out the emphasis areas around strong mission. And when we look at the 828 foundations, we're going to be applying that against the 4 principles, 2, 28, 19, and 24 on the National Accreditation Standard. So I want to just say something really quickly about strong mission, and I know I'm running out of time, Frank. I've only got a couple more slides. So strong mission, this is, again, where we circle back to those ideas around engagement and of those people who live in the community with the organizations that are striving to make it better. There's the purpose, the contribution, the interconnectedness, and synergy. That interconnectedness as well as synergy, that really circles back to that idea of relationship building, and all of them have the undertone of engagement to be able to get to that. You can't really have contributions or interconnectedness without engagement. And so we feel like it's going to come up pretty critically important, this idea around engagement of people that live there. And then examining relations between the national standards and our community well-being indicators. We're going to look for both positive and negative correlations, and we're going to use those 4 national community standards, and then Vanderweel's framework and some of those indicators for strong mission. We're not really seeking to say that the national standards are the way to go or not the way to go. We're just looking at how to explore how the standards help to look at the work and describe that work of engaged community foundations in place. And one of the things that we hope will come of this is that community development organizations, of which there are numerous, tens of thousands throughout the U.S., can better understand how they can be better partners with their community foundations, but vice versa too, that maybe the community development foundations can be better positioned to help with the engagement community component that community foundations face. So finally, last slide, is that they're critical entities. They, for community foundations are helping enhance quality of life, improve community well-being. There's a strong capacity there for addressing local problems and issues, and that we want to see how we can help bridge that gaps a bit between the study of community philanthropy and community well-being and quality of life. There isn't that much out there yet, as I've mentioned earlier, and we're hoping we can help make that a stronger bridge. And that's pretty much it. I've got a few references we can share. Again, we can share this whole slide set with you if you like. And apologies on the tech. I don't know why. But anyway, I'm here, so if you have questions, or Frank, do we need to move on to other things and then come back to Q&A, or what do we need to do at this point?
Thank you, Rhonda. Very, very helpful to see this broad perspective on community foundations, and being in the community foundation world, I definitely see how relevant and helpful it will be. We don't have any questions currently posted. I'll keep my eye out for them. But we do have a scheduled Q&A session time period at 2:45 where we can certainly ask questions of any of the presenters, including this one. So I'll keep my eye out for questions. I want to thank you, Rhonda, and we'll move on to our next presentation, which is Don Madsen with the Tower Foundation. So sound good, Rhonda?
That sounds good. Thank you all.
Okay, thank you. Thanks. So Don, I think I saw you earlier. If you could go ahead and click on the screen, sharing on the top, and start sharing your presentation, that would enable us to see them. And I see Tracy. Thank you.
Gods and take that out for a spin. So sit tight for just a second.
So we hear you now. Don, you're saying take something out for a spin?
Yeah, no, Tracy and I pre-recorded a video, which is in the video queue. So we're going to go ahead and take that out for a spin and see if the technology gods smile on us.
Sounds great.
All right. So
And Tracy Sawicki, thank you. Also, I didn't have you on my
No,
list, so so thank you for presenting as well.
no worries.
okay, so hopefully people are seeing a video with Tracy.
And
Well, just Tracy at the moment.
Yes.
All right, here we go.
Hi, I'm Tracy Sawicki, the Executive Director of the Peter and Elizabeth Tower Foundation in Buffalo, New York.
I'm Don Madison. I'm Chief Program Officer at the Peter and Elizabeth Tower Foundation.
The Tower Foundation is a family foundation formed in 1990 by Peter Tower and his wife Elizabeth. The foundation supports and collaborates with nonprofit organizations and community partners that share our goal of helping children, adolescents, and young people affected by intellectual disabilities, learning disabilities, mental illness, and substance use disorders. Our work is focused primarily in Western New York and Eastern Massachusetts, areas that are important to the Tower family. The Foundation's community indicators work began several years ago when we embarked on a planning process to determine
Of that, so we'll give this another try.
strategic direction using results-based accountability, or RBA for short. We decided on the RBA method because it could be applied across the Foundation's core focus area, or RBA for short, and for its strong emphasis on measurement at both the performance and the population level. Always gathered data about how the projects we fund are performing, and we firmly believe the grants we make improve lives. But we weren't always clear about the big picture. We knew having a knowledge and a strong understanding of what was happening at the community level would benefit our grant making. RBA provided a clear process and a structure to accomplish this. The RBA process began with trustees and staff creating result statements for each of our specified populations. Think of these as states of well-being. That's how RBA refers to them. We vetted these across community stakeholders throughout the Foundation's funding regions to make certain they were easily understood, relevant, and important priorities for the community. Next, we needed to identify community-level indicators to monitor progress towards our stated results. Staff, trustees, and community stakeholders suggested numerous possible indicators for each result statement. Using specific criteria, we narrowed the list and chose final indicators. After this, we engaged in the final steps of the RBA process to complete our plan. Our internal capacity was limited, so we engaged Wilder Research of St. Paul, Minnesota to collect, compile, and report indicator data. As many of you know, Wilder has extensive experience in this area. The first step was to establish baseline data for our indicators. The Wilder team started identifying sources that had indicator data for our specific funding geography. In some instances, data was readily available. In others, it was not. Wilder found data sources addressing substance use disorders and mental health. However, there was no data for our intellectual disabilities and learning disabilities indicators. When we started, we knew this was a real possibility given the nature of some of our indicators. We used available data sources, such as the National Survey on Drug Use and Health, whenever possible, and engaged in primary data collection where needed. Don will go into this in more detail shortly. We thought about why the data we wanted was not available and couldn't help think it had to do with the populations. Think about it. Young people with intellectual disabilities, learning disabilities, mental illness, and substance use disorders are often marginalized, as are their families. Was the absence of data another indicator of marginalization? Well, we weren't sure, but we started thinking about the opportunity this presented to bring attention to these marginalized groups in the communities where they live and where the Foundation does its grant making.
As Tracy mentioned, we decided to work with Wilder Research to develop our community indicators. Their team embraced the RBA approach and they had extensive experience with community indicators. So the Wilder folks scoured available data sources and showed us lots of options. As you can see on this slide, we landed on about a dozen indicators that lined up with our results statements that we could get from existing public sources or obtain from state agencies with just a little bit of haggling. I'll just spend a couple of minutes highlighting 3 examples of places where secondary data created challenges for us. First, geography was a pretty big headache. We were looking for county level indicators, but we had a hard time finding county data in some cases. In other cases, we could find historical data for counties, but the counties were combined in subsequent years. For instance, we just recently learned that the latest data from one of our sources are now being reported regionally as the 8 counties of Western New York instead of county by county. Another geography-related challenge had to do with national surveys. They would sometimes have a pretty small number of respondents from within our counties of interest. And because of that, estimates on some indicators fluctuated quite a bit over time. We tried to get around that by pooling 3 years of data and using an average, but that's still a little bit clunky. Third, in the latest round of data, we've learned that there might be some instrumentation effects. I think it's the National Survey of Drug Use and Health that changed the order of some questions in the most recent version. And their internal analyses suggest that the revised question order has actually affected the responses, making comparisons over time a little bit suspect. So if you take a closer look at the list and recall what Tracy mentioned as far as the Foundation's 4 focus areas, you'll see an awful lot of indicators for substance use disorders and 1 or 2 for mental health and intellectual disabilities. There are absolutely no indicators on learning disabilities from existing data sources that we or Wilder Research could find. We recognized that our specific results statements were not well represented in existing data, so we had to make a decision. Abandon the results statements we didn't have data for, or get to work on a data development agenda. If we'd given up on the results statements, this would be a much shorter presentation. Obviously, we decided to go ahead and collect our own data. After we spent some time kicking around different questions and sampling strategies, we launched our first community survey in 2017. This slide shows you what information we gathered from community members. We sent community survey invitations to a total of 12,000 households in our geographies, selected via stratified random sample. Respondents got a $20 gift card for Amazon, Walmart, or Target for completing the survey. We supplemented the community-wide surveys with more targeted surveys of parents of children with intellectual disabilities or learning disabilities. Those we recruited through the organizations we fund, but we still had relatively few respondents for this. So we ended up keeping the results of these surveys and further follow-up with young people with learning disabilities and intellectual disabilities. We kept that off of our web-based data dashboard and shared the results as narrative reports. The community surveys went pretty smoothly, and we feel pretty good about the data we collected on that front. But we did have quite a few challenges with the parent and youth surveys, though. So as I mentioned, we had trouble with response rates for the parent surveys. I had the bright idea of trying to bolster that using Facebook advertising, which got us a lot of extra responses, most of them from bots, so that maybe could have gone better. Along the same lines, because we had so few respondents overall, we ended up having to combine all of the responses from the counties in each state into a Massachusetts report and a Western New York report. We're wrapping up the analysis on our 2019 community survey right now, and we've just gone over the drafts of the 2020 parent and youth survey reports. We got many more responses in 2019 and 2020, mainly because we sent out 18,000 community survey invitations, and we also used those as a way to direct parents of children with learning disabilities and intellectual disabilities to the parent survey.
The foundation was committed to sharing the data. Working together with Wilder and our web designer and developer, we created a section of our website dedicated to this. We wanted a dashboard that was accessible, user-friendly, attractive, and available to all. Last summer, we had our baseline data and launched the Tower Data Dashboard. Users can sort data by focus area, indicator, and geographic area. And while there's only one data point right now, we'll be updating it very soon with the next round of data.
Like Tracy said, even though we've been working on our community indicators for nearly 5 years, we've only just gotten to putting out our baseline data on the dashboard. Once we have our second round of data posted this fall, we'll make a push to let the community know what data we've got and encourage them to make use of the information.
When it comes to using the data, we have lots of plans. However, when it comes to implementing them, admittedly, we're just getting started. It took a bit of time to gather baseline data for our indicators, especially because several required primary data collection. The data has so many uses. For the foundation, it keeps a big picture up front and center and provides data that can inform our grant-making strategies. It tells a story that is not only beneficial to the Tower Foundation, but to numerous community stakeholders who care about the well-being of the community.
One additional piece that we're working on involves trying to obtain disaggregated data. We started taking a look at our diversity, equity, and inclusion practices over the past year. And one thing that's been abundantly clear now is that we need to look closely at differences in outcomes by race. And this is something that we'll be looking at for our next round of community surveys in 2021.
The foundation will convene stakeholders to discuss this data and facilitate collaboration that leads to action. We will also use the data in ways that spark curiosity, leading to further learning and a deeper understanding of the children and adolescents and young adults affected by intellectual disabilities, learning disabilities, mental illness, and/or substance use disorders living in the various communities where Tower grants are made.
Thank you, Tracy. Thank you, Don. I can see why making the video ahead of time is so effective. That was very, very well produced, and it really gave us some insight into the entire process. Please, if anyone has questions, please post them. I don't see any yet. And so I'll simply say that, it's impressive. So many local funders, when they find out that there are no data that really address the needs they've identified, simply either change priorities or decide not to measure. And so it is really reassuring to see all the work that you've done and the work that you've done with Wilder to really forge forward and produce a data set that will be helpful not only to you, but to others. If you had to do it again, would you still go ahead and go ahead and try to collect your own data?
Absolutely. It was part of what we said was, again, there was so much data that we were looking for that didn't exist. And that was one thing that we felt as a foundation that we could do as a contribution towards a picture of the communities in which we work. So it's taken a long time. And sometimes, your trustees and others are like, geez, this takes a long time. But we're firmly committed to, again, raising, information about different members of the community, and in particular, the 4 groups that we work with.
Yeah, the only thing I would add to that is looking back, we actually did have a rationale for not collecting disaggregated data. We were approaching this work with the idea that substance use disorders, mental illness, intellectual disabilities, learning disabilities, they in themselves do not discriminate by race. We didn't really play that song to the end and think about how race disproportionately affects outcomes. So the only thing I would say is if we had it to do again, we would have started collecting the information we needed to disaggregate data right from the get-go. We are a little bit challenged as far as the secondary data go, though, because in a number of instances, because there are relatively few cases in the counties that we're interested in, getting the disaggregated data by race will be a real challenge. So, I talked about how in some instances we had to combine multiple years to sort of stabilize estimates. That's going to continue to be an issue for us when it comes to the secondary data. So disaggregating, that's going to be very, very tricky. We think we're going to have better luck on the primary data collection.
Very, very helpful. Thank you. So we'll keep our eye out for questions that pop up. Again, we have an upcoming Q&A session. We actually have 2 scheduled for this afternoon. So plenty of opportunity to continue to discuss. I know there are definitely themes, at least in my presentation, that will be mirrored. Without further ado then, thank you both for your presentation. And we'll shift over to Nancy Anthony from Oklahoma City Community Foundation. We're a little bit behind on time, but I'm hoping that our Q&A time periods will catch us up. So Nancy, are you there? Josh, you're there. Thank you.
Yes. Yeah, I'm here. Okay. Did we lose Nancy? I hear Nancy. Nancy, are you there? We can't see you. We can hear you.
Yeah, we're trying to turn it on.
Okay, you should, if you click on the screen, so we have your voice, which is great for the presentation. If you go up next to there's the microphone, then there's the video record, the camera, and then there's the screen. If you click on that, it should give you the option to share your screen. Yep.
Right. Are we ready to go now?
Yep. We just don't see your screen yet with your PowerPoint.
Oh, well, this is a low-tech presentation. We don't have any slides and we don't have any videos.
Perfect. Then we're ready to go.
And more than that, we have a train that periodically goes through here, so you might hear that too.
I like
So having said that, I'm Nancy Anthony with the Oklahoma City Community Foundation. I've been here for more than 30 years, and I hope you don't think that I couldn't find anything else better to do, because I've always liked my job. I came to philanthropy with a background in demography and epidemiology, and now that everyone knows what epidemiology is, for a long time they didn't. It has been interesting to be able to look at philanthropy and understand how philanthropy can be looked at, and issues in the community can be looked at in terms of how they impact different demographic groups and how they move through different groups of people. So one of the things I've learned here at working with not-for-profit organizations trying to take advantage of both needs and opportunities is that most people needing services really have more than one problem. They're generally very interconnected with a lot of issues. In health, we talk about social determinants of health. There generally are a lot of issues that need to be addressed when we're trying to help people and try to improve the quality of life of people. So generally all this dictates solutions and approaches that are very interactive and that involve a lot of different information. So when we put services together for different groups of people, we need to look at where they are, where the people are, and what other kinds of issues there might be. Here in Oklahoma City, we have had worked with a number of organizations for a long period of time with endowment funds. So we have about 300 organizations that we have maintained information about what kind of services they provide in the community. And about 10 years ago, we decided to try to put that information out so that other people, other donors especially, could use that. Within the last couple of years, we've taken on trying to move that information not only from a very static listing, but to try to map those organizations throughout the geography of Oklahoma City. Oklahoma City is a very large community. It's probably the second largest geographic city in the country. So we need to deal with things sometimes on a very localized level, whether that be census tract or zip code, or even smaller areas than that. So we really needed to be able to look at the services that were being provided in the community in terms of where they were located. And when we looked at needs or opportunities, we also wanted to look at who are the service providers there and how will we begin to address that. So we had an opportunity with the group called Thriving Cities to begin to map all that. And we really feel very, very fortunate to be able to begin to look at the issues in our community. Unlike some of the previous presenters that are very focused on a particular issue or a particular focus, our issue really is how do we make as much information as possible available to everyone in the community so that we can jointly begin to share with the idea of looking at things in a very holistic way. So one of the best examples for that for us right now is around health. We have very poor health indicators in Oklahoma City, but we realized that even though we have poor indicators, they're not poor in all parts of the community. And really, if you want to begin to address some of the issues, you really needed to look in the areas of the community where those indicators had the most challenge and where we could begin to provide services that were really directed in those areas. And so, in other words, just to be more specific, rather than very broadly general, and to encourage the organizations with which we worked to also be specific in that regard. Another example in that same arena is teenage pregnancy. We have a significant problem in Oklahoma City with teenage pregnancy, but it turns out that it's not all equal across the community. And if you're going to provide services to encourage teenage girls to take different tact, there are very specific zip codes and very specific geographic areas that you can begin to provide some great alternatives for those girls. So looking at things in a very specific way has been very important for us in terms of not only specific problems, but also in terms of working with the organizations that are taking on different things and making sure that they have the data that's out there. So putting together the information that we have about not-for-profit organizations, putting together demographic information, and then even things like health indicators and information, some environmental information that we have, and creating a very sophisticated database that many people in the community can use is really important to us, because what we're trying to do as much as anything is empower other people to utilize this data and to provide a platform. So I will turn it over to Josh and let him give you a little bit more sophisticated background about what we're really doing.
Thanks, Nancy, and thanks everyone for the opportunity to be here. I'm not sure it's going to be more sophisticated, but I'll tell a little bit of the journey Thriving Cities. So I wear two hats. I'm a cultural sociologist. I'm now based at Duke University, and then I founded and run the Thriving Cities group. The basic mission of the group is to come alongside community anchors and residents to help them understand their communities as holistic ecosystems, and to have the will and ability to work across those ecosystems for mutual benefit. Out of the gate in the early days of our work, we realized that data was going to be crucial to that missional purpose. And many of the folks that we were working with on the ground in cities across the United States were really wrestling with 4 questions, and I've heard them all both raised and addressed in beautiful ways on this call, but I call them 4 how do we questions. So the first question, of course, is how do we measure? Fill in the blank. How do we measure? We just heard, how do we measure certain kinds of mental health, intellectual disabilities, and so forth? And how do we do that well and wisely? How do we disaggregate the data? That actually, in that effort, by the way, connected me to CIC. We helped create by looking at, in the same way that the academic pair here, Rhonda and Patsy, are looking at community foundation well-being indicators. We looked at the CIC's membership list and looked at the leading indicators of health and well-being that cities were using around the country, and created something called the Indicator Explorer tool, where it basically asked which are the leading indicators in terms of which communities are using most often which indicators, and how much research validity backs up those indicators. But again, that was just sort of taking indicator by indicator approach, and as valuable as that is, of course, we all know that there are other questions, other how do we questions. And so a second how do we question is, how do we leverage this data to drive and inform wise action? And we heard that in the keynote speaker earlier, and it's been raised here. So for both informing the interventions and then helping to think about evaluation of impact on the back end. A third how do we question was then, how do we harness the wisdom and experience of the entire community, not just those of us who are sort of thinking about it from afar, but in many cases, a range of stakeholders in the community, including those that we're trying to help. Rarely do we actually spend much time with the folks we're trying to help or come alongside in getting their input on the indicators, or even helping to frame the questions in the first place. And then the fourth how do we question is, how do we illuminate or see the interconnections, or we might say the intersections of the different issues. And Nancy was mentioning this about how often it is, we all know this in practice, but rarely does it factor into our theories of change or the ways in which we approach issues, is to see the points of interconnection, to know what's upstream from something, a particular kind of indicator we're looking at, what's downstream, and understanding that web of interconnection that especially the most vulnerable get caught in. So it's not, you can't just address one issue at a time. You have to look at it holistically. And so bringing together the indicators, thinking about how that gets disaggregated by geography and how important geography is in a community, and then mapping onto that all of the organizations that are working on those issues and where they're working on them is sort of a start in what we're partnering with Nancy and other community foundations and collective impact organizations to do. And we think that's really, in some ways, just a step one, a foundational kind of move. And there's a lot more to be done, especially right now in terms of the overlapping crises, converging crises of COVID, of racial injustice, of the economic impacts of these things. We're seeing a moment when we're beginning to need certain forms of data and infrastructure around data that perhaps we hadn't quite understood the importance of before. And having good data, of course, is crucial. So it's raising, these kinds of crises are putting to the foreground the importance of a kind of crucial underlying data infrastructure in communities in our moment. And I'll turn it back to Nancy before I close about how she's sort of experiencing this sort of important, this perfect storm of converging crises and how that's revealing sort of certain forms of data poverty really within the system at large.
Thanks, Josh. And let me just go back to the health indicator thing, because that is, we have been working just in the last 2 weeks with a group of people through the public health organization here, not only with respect to COVID cases, which we can do by zip code, but we can really begin to think through so many other things. And it's going to be really important. They are so hungry for that data and for the ability for us to have the ability to not only be able to map that for them, map their data in terms of the zip codes, but also add to that the demographic data that's available and service provider data is going to be incredibly helpful in looking together and looking at solutions and what's possible very quickly. And then the next question be, and what else do we need to do? So it gives us a chance to look at what might already be in place if we could, in fact, empower it more. And also then look at what do we need to add for the kinds of solutions that might be out there. So we're gonna have questions being asked, questions that we've never been asked before, and we hope to have the data in place to be able to at least begin to answer those questions.
Yeah, that's exactly right. And I'm glad you mentioned the kind of health data. So, a big shout out to a group we've been working with, the NYU City Health Dashboard, and their vulnerability index in particular is a great example of what we're talking about. And there are many others that have been quietly toiling away to get really crucial pieces of data, especially for the most vulnerable in our communities. And I think that there's a great opportunity for all of those who are on this call and in this conference to ask ourselves the question that I want to leave us with, which is, what is it that this particular community can do, a community of funders and philanthropy, a community of data and indicator projects, and others that are interested in these questions, what might we do together? What is it for us to do together around building the comparable kind and forms of data, getting the right data sets to answer new kinds of questions that perhaps we haven't asked before? And so I'll just leave this as a closing invitation that we think in our moment, there are three crucial needs that we're looking to join others on addressing. So one is establishing a learning community out of this kind of a wider community of practice around data and vulnerability and opportunity. To identify, this is the second piece, identify and connect with kind of the best of existing data sets. And then, like the Tower Foundation, identify those places where the data just simply don't exist and need to exist. And third, this is really crucial given all we've been talking about in terms of place-basedness, spatially and temporally normalize the data so that they can actually be effectively used together to get that holistic picture. So that's kind of what we're excited to do next with Oklahoma City and and many others that we're already working with. And if anybody on this call is interested in learning more about that or connecting with us, I'd recommend you go to involve.city. There's a sign up for, we're looking for all comers to have a community-wide ongoing conversation around these themes. So thanks so much for letting us present. This has been really, really rich, and we're glad to be part of the conversation.
Thank you both. Thank you. It's great to see some of these themes, arising. And Josh, you already pulled a bunch of the connections together that I was thinking were important to follow up on. We do have a question from Samantha Breslin, but I think it will pertain to yours as well as the Tower Foundation and a few others. So I'm going to save it for the question time period, but it has to do with, when you actually go about identifying ways to collect data. So I'll keep my eyes open for specific questions to your presentation. And please, as you do post your questions to the Q&A, if you have a specific presenter you'd like to respond to, please indicate that. But thank you, Nancy and Josh. This is important work, and it's great to see you building on these themes. For the sake of time, we'll move on to our next presenter, which is Nadia Viliani from the Greater Houston Community Foundation. And she'll be talking about using data to drive philanthropy during COVID-19. So building on some of this theme that Nancy and Josh have pointed out about, local data and the importance of local data, how do we then move toward applying data in this time of a pandemic? So Nadia, I believe your screen slides are loading. Very great. I see them now, and I believe you'll be popping onto the screen soon. I just want to double check that your mic works. Can you say something, Nadia?
Yes. Hi, everybody.
Great. Thank you. I can hear you well. So go ahead and welcome, and thank you for presenting.
Great. Hi. Hello, everyone. I'm very happy to be here with you today, subbing for Diana Zarzuelo, our Senior Director of Community Philanthropy. I'm humbled to be among all of you accomplished panelists and, of course, everybody in the audience. I am here today to discuss how the Greater Houston Community Foundation has actively used data to drive our philanthropic efforts during this pandemic, not only internally, but also among our stakeholders and the overall community. So as many of you know, Houston is not new to disasters. There have been 6 federally declared disasters in our region in the past 5 years alone. However, we, along with the rest of this country, were new to this particular kind of disaster. So what we did was we basically adapted our proven strategies to this public health crisis and, of course, the resulting economic recession. And we also tried a few new things, which we're excited to tell you about today. So in the time that we have together, I'll discuss how the foundation and its regional indicators project, Understanding Houston, use data to inform our internal grant-making efforts at every stage. And then how we used our pre-existing and new data to shine a light on relevant related issues of the disaster. And then, of course, we also prioritize data sharing and transparency to support broader community-wide relief efforts and recovery efforts. So as I talk about these 3 buckets, it's important to recognize that they're all interconnected. We prioritize sharing data and transparency while using that data to inform our grant-making strategy and recommendations. So these all will intersect. So first, I'm sure we all remember it clearly. I remember it was Friday the 13th in March. It was a very big day. I believe it was the first case of community spread in Houston that was reported, along with the news that beloved actor Tom Hanks tested positive for COVID-19. I feel like that's like intended in my memory. So this was when we actually distributed our first nonprofit capacity and needs survey to our close nonprofit partners. Essentially, we wanted to learn quickly what they were seeing, what they were needing, and how they were preparing for the impending increase in demand for services. So we knew that this data would be valuable to other funders, donors, and the general community. So we engaged a Tableau genius which I am not, from one of our partner organizations to create an interactive real-time dashboard of the survey results, which live on our Recovery Fund site. So I believe I'm happy to send these slides out to everybody. I've embedded some links in here so you can click on them. This is the website of our fund. So you can look at you can look at what I'm about to share. So in partnership with the United Way of Greater Houston, we created the Recovery Fund at GHCF. We wanted to ensure there was an efficient and transparent way for nonprofits to submit rapid letters of inquiry. So what we did was we created this online letter of inquiry form, and we received over 500 responses. We were really excited. This survey was embedded in the Recovery Fund website as well. So what was really great about this is the first survey we did, basically we reached out to our close nonprofit partners, folks that have demonstrated and proven disaster relief work, primarily, of course, from our experiences from Hurricane Harvey and Imelda. But what this online letter of inquiry form did was expose us to a lot of new organizations. Sometimes we see the same faces over and over when it comes to philanthropy. This was really great because it gave other organizations that were perhaps smaller or more niche to really get on our radar. So that was a really great benefit of the LOI form. Let's see. So the first round of fund distribution focused on food and emergency financial assistance to individuals and households. The second round was a little bit more flexible as we offered housing assistance and services, holistic services, in addition to food and the general emergency fund. So for that reason, what we wanted to do was to be more strategic. I think early on in the pandemic, one of the adages that we kept hearing was, disease doesn't discriminate. But we all know that that's not true at all. It absolutely does. So we wanted to make sure that there was an opportunity to look at all of the pre-existing data in a particular area. And around the time we were doing the second fund distribution, there was a lot more COVID-related data. So the Texas Workforce Commission was publishing data weekly on the number of unemployment insurance claims disaggregated by zip codes and industry and things like that, which they don't typically provide in such detail. We also, of course, were getting COVID cases by zip code, among other indicators. So we took the data, pre-existing data, things like what is the median household income or percent of communities living in poverty. We heard, of course, that, communities of color, primarily Black and Latino, were being affected more than others. So we were looking at the percentage of the community that identified as that population to really prioritize certain zip codes in our community. And then we created a map, which you can see here, where we identified what those disproportionately impacted zip codes were. And, in Houston, we always talk about this arrow. Like you can kind of see there's this little bit of arrow. So this arrow, if you overlay almost anything, you will see the same arrow. And it's predominantly white, higher income, wealthier areas. And the blue designates the disproportionately impacted zip. So you can kind of see, obviously, this is exactly what we were expecting, but we were able to look very nuanced into the data. And we did this for the 4-county region. So if you click on the map, you'll be able to see the full 4-county region that we are serving through the fund. So we identified the vulnerable areas and looked for agencies and organizations that had a strong history of service in those areas, but also with specific communities in those areas. So we were hoping for maximum and efficient impact of resources. We're in the process of updating this map. It's a little bit older. It was when we first started, I believe, back in mid-May. So we're updating it again with with current data, but as well as data from our grantees about the number of individuals and households served by zip code. So we can continue to reassess where the greatest needs are. So if we're seeing that we're getting a little bit more impact perhaps here in the southwest corner of Houston, we may, try to focus a little bit more on the eastern side, which is always in need. So as you guessed it, the map and the methods are also available on the fund's website. And so finally, on this slide, we're managing two funds simultaneously. So we have our private fund with the foundation, and we're also administering a public fund from Harris County. So we use data-driven strategy to deploy funds in this fund as well. We looked again at various factors, but primarily the social vulnerability index, which we've heard about already today. We prioritized those in a particular quartile, and we looked at the different regions that were of that quartile 4, the darker blue here. And we sent targeted text messages to people living in those areas, informing them of the fund and encouraging them to apply. So this was a pretty new tactic that we used, and it proved to be successful. We used the same data to prioritize the lottery. So sometimes when the public is able to apply for funds, the typical strategy is just first come, first served. However, we wanted it to be more equitable. So perhaps folks who weren't as able to quickly respond, they may be the ones who need the funds the most, perhaps. So we also used a lottery method that was informed by the social vulnerability index, among other factors, in determining who would actually be able to receive checks, essentially. So the second is that we used the voice and the platform of our Regional Indicators project to shine a light on important related issues. So we primarily used secondary data, but we also integrated our primary data from the surveys and the inquiry forms. So for example, we drafted a blog on the potential impact of COVID in our region. The census was also in high gear at that time, and we knew that it was still important to discuss the census and completing the census during a pandemic. In fact, even more so. Excuse me. We drafted a blog on the Paycheck Protection Program, primarily as it helped or did not help minority-owned businesses and business owners. And we heard that there was county leadership read that blog and used some of that information to inform the Harris County Small Business Fund that was developed. And so, of course, we also learned the important role of social media plays during disasters after Hurricane Harvey in particular. So we used our social platforms to disseminate research, both our own about what nonprofits need, but also anything relevant. So, the Urban Institute, of course, has been phenomenal. This is just a bit of a screenshot from our Understanding Houston Facebook, where there was quick surveys about how people are doing back in March and April. We learned that in a time when, so we also gained many followers at this time, which of course isn't necessarily an indicator of impact, but several of them were high profile, indicating that the data was useful and informative in decision-making at large. We learned also that in a time when everything is an emergency, it's really hard to know where to begin. Framing and explaining some of these various issues, I think, helped reverse a little bit of the paralysis for some folks. Obviously, people who maybe are less used to disasters, I would say. And it gives people a place to start, kind of like a way of making sense of the unknown. So we found these narratives to be great, and we're continuing to update our blogs and narratives with new data as they come out. And so finally, data sharing and transparency. So as you've noticed, sharing data and being transparent about our process was key. We are a community foundation. Of course, we work for our community, we engage our community, and we're accountable to the community.
Hi, I'm Tracy Sawicki.
It seems like we went to the next presentation by accident. Oh, and the prior one. Sorry about that, Nadia. I don't know if someone's moving that. Maybe if you just go to screen and share again, Nadia, and just, yep, there you go.
Great. Okay. So yes, and we're accountable to our community. So a commitment to data, of course, will require transparency, and this is a value most of us share. But in times of crisis, of course, it's much harder to actually execute because it requires thoughtful planning and intention, attributes that are in very short supply during an emergency. But this is the difference between making it a priority versus something that's just nice to have. And so we felt it was
Don
pretty
Madison.
cool.
I'm the Chief Program Officer. I'm Don Madison. I'm the Chief Program Officer at the Peter and Elizabeth Tower Foundation.
I'm not touching this, I swear.
Okay, yeah, I'm not touching either. Did you have another slide, Nadia, or was that your? Oh, there we are. Okay.
No, I'm still going. I'll try to wrap it up soon. So we put everything online, dashboards, maps, survey results, et cetera, as you saw, it's all in one place. We also engaged weekly. So these are the ways in which we shared our data, and we're transparent, of course. We engaged weekly with a local grant makers forum where we shared the results from the online letter of inquiry as well as the survey with other grant makers so that they didn't have to duplicate the process. We knew that we were hearing nonprofits were inundated with surveys around this time, and they just wanted to focus on doing the work. So we tried to make sure that there were as few surveys as possible. And of course, collaboration is key. We can't do anything alone in the best of times, and of course, it's impossible in the worst of times. So we created the Recovery Fund in partnership with the United Way of Greater Houston. We collaborated and consulted with other partners in creating our dashboards and maps to fill in our skills gap and also just distribute the work. A local data analytics firm had been tracking evictions in the region, so we also engaged them to write a blog on their findings. It was very timely as the moratorium on evictions was set to expire that particular week. And we also supported regional foundation partners like the Galveston Community Foundation in their survey and inquiry efforts. Also the grant application. So we shared grant application data with fellow funders so that they could help fill in the gaps. Of course, the need is great and the pot of money is not nearly enough. So we shared information with other funders so they can support organizations who were not awarded their full request, or maybe organizations that were denied and in the hopes that they could secure funding from other sources. Many of our funder partners notified us about how helpful this was, and they did actually make awards using this information. We also did a collaborative funder survey. So we distributed a survey to our funders to assess what the philanthropic response in COVID-19 was. We shared this with other funders, with our nonprofit partners, and broadly as well, just so people could kind of get a sense of the other side of the coin. And then finally, for the public Harris County Fund, data transparency is always important, but we felt that it was essential when we were talking about public money. So the same data analytics firm that created the evictions dashboard called January Advisors, they created a real-time dashboard of areas of need combined with where the applicants lived and where those who received services live to ensure we're targeting the hardest hit communities. And that's linked here as well. So when we send out the slides, you can take a look. I know we're short on time, so I just want to finish. I want to thank all of you for your time. I hope this was informative. We'd love to learn a little bit about how you also have been using data to drive philanthropy during this pandemic. So feel free to reach out to me if you have any suggestions or comments or questions. We'd love to hear from you, and my email is right there.
Thank you, Nadia. Thank you. Very, very helpful. Certainly, I'm going to want to follow up on some of your techniques, the texting of messages to targeted neighborhoods and things like that. Would be very helpful for us. I'm watching to see if any questions pop up specific to you. Tom Kelly and Nick Redding are next from Hawaii Community Foundation. As you set up your screen, I can go ahead and hit a question or two. So please go ahead and set up your screen. One from Nancy Watson is for IME. You said your organization was shifting from a theory of change to a theory of philanthropy approach. Could you please explain what you see as the difference? So IME, can you go ahead? Are you there? Amy? Okay, we can return. We do have another Q&A session coming up. We also have another question from Samantha Breslin that I mentioned earlier. Some of our presenters spoke about using data from the American Community Survey, as well as your own locally collected or in-house data sets. Can you talk a little bit more about how you might use external or proprietary data? A, how you identify potential data providers, and B, integrate with your existing data. So I know certainly we had a Tower Foundation talking about this, and I think there was some hinting at it from Oklahoma City. Does anyone want to respond to that question?
Yeah, I'm happy to if no one else wants to go yet. So yes, we look at ACS data, but we also look at proprietary data as it has to do with businesses, employees, of course, Bureau of Labor Statistics, for the CARES Act, for example, small business grants. But we are also doing something called an equity study in Santa Barbara County. A number of counties have done this around the state of California with USC. And in that equity study, what we do is we go immediately to the back on the data and methods and pull all of the data sources, publicly sourced sources that may be dated. And from that, we identify, for example, donor giving data from Experian or other prospective data providers that might tell us trends in giving. And if we see the trends in giving, we can also see the gaps in the highest need areas for recovery of COVID-19. So I kind of jumped all over the place, but we do look at ACS, NADA, Bureau of Labor Statistics, and all the public sources. We identify those gaps, and then we look at privatized data that we can either usually get through a group like Cal Nonprofits or analysts and firms that actually have sources, are able to actually access some of the private data for donors and giving.
Thank you, Rubai. Does anyone else want to respond to that question about?
This is Nancy. I would just very quickly say that working with the Thriving Cities group, they provided a platform for us. That had demographic data from the census by both zip code and census tract. We were able to map onto that a number of service providers in their service areas. And then our next job is to try to map onto that the health data that we have collected, which has been collected locally primarily by census tract and has a pretty significant amount of history related to it. So we feel very good about a platform that we're able to add local things to, but we also, because it can automatically update census data as it's available. So it's been a very productive platform for us.
Thank you, Nancy. Thank you. Amy, I see you're on. Did you want to respond to the question about shifting from theory of change to theory of philanthropy?
Yeah, sure. Sorry, I don't know what happened. My computer kind of froze. I would say the biggest change is really taking a look at our role and teasing out what we're doing, where we see, where we're putting the investments, the time, the energy, the work, and in partnership, and understanding what that continuum looks like. So things that we have in control, and then recognizing the ecosystem in which we operate in. And so I think that, the theory of philanthropy really takes into consideration the ecosystem and the broader, that we're one player in a broader system. Whereas the theory of change, we have, I guess, you've got the activities that would then lead to the outputs, outcomes, and everything ideally is within a controlled system. So I would say that is probably the biggest difference.
Thank you. Thank you. And I know of certain community foundations that have taken that into consideration with their strategic plans, they committing to moving a needle, kind of like we hear from Fairfield, but also realizing it's not just us that's trying to move that needle, it's the whole community, and we can't take credit or full blame if it doesn't work. So thank you. Mm-hmm. Okay, I think we don't have any new questions coming in, but feel free to please submit your new questions. I believe we're now ready for our next presenters, and look at that, only 3 minutes behind schedule, which is fantastic. So we have Thomas Kelly and Nick Redding from Hawaii Community Foundation. So please go ahead, and I'm not sure if you're going to use your pre-recorded portion or not. I think the computer just froze.
Frank, thank you. I'll go ahead and I pre-recorded. Guys, are you hearing me?
I can hear you. It's a little choppy, Tom.
Okay. I will go ahead. Actually, Frank, cue up the video. It's better. Can you do that, or does it slow you up?
Let's see. Here we go.
Hello, this is Tom Kelly from the Hawaii Community Foundation, and I'm going to be presenting with Nick Redding from the Hawaii Data Collaborative today on how we've been using synthetic community modeling to plan our COVID relief and recovery here in the state. Hawaii Community Foundation is one of the oldest community foundations in the country. We are a statewide community foundation that both raises and distributes funds throughout the islands with staff across all the islands. A few years ago, we started to reorganize and reframe how we deliver our mission throughout the islands, organized around areas of community well-being that cover the landscape from the economy to arts and culture to civic engagement and health and education. We are grounding this in data on well-being in each of these areas, but also focusing on where the biggest inequities are. This was a framework that we had in place starting 2 years ago, and our focus on equity in a place as racially diverse as Hawaii really grew out of and used the United Way, our Aloha United Way framework, a framework on ALICE. ALICE is asset limited, income constrained, and employed.
We lost sound for a second.
What we sometimes are used to call the working poor. And significantly here in Hawaii, with a large, low-wage tourist economy and a high cost of living, more than 40% of our families are ALICE and below. And so this has continued to be a key focus for us in terms of worrying about inequities across the spectrum of well-being here in the state. We also went into the beginning of this year already with a disaster planning framework. Unfortunately, COVID was the fourth disaster that the Community Foundation has dealt with in the last 2 years after lava, flooding, and wildfires. And so we went into the pandemic having already put in place a framework to think about emergency relief in particular, adding a phase for risk reduction because of COVID. Now that we've completed investments, or although we are still continuing some in terms of risk reduction and food and housing eviction prevention, we're turning towards planning for recovery, stabilization, and long-term resilience, and really have wanted to lean on data that would help us guide the choices, the policies, and the investments that we need to really go back and address inequalities in our community. It's most significant here in Hawaii, although I'm sure in all of your communities, the unemployment rate skyrocketed in March and April. In our case, it was heavily in the tourism sector of hotel, retail, and restaurants, with our estimate that that sector will not return very quickly maybe not even for a full decade. So as we turn towards trying to plan for recovery investments, we really wanted to know what data could we rely on in order to make some informed, effective, both policy and philanthropy investments. So do we know what the true impacts are in families, particularly in ALICE families, when we don't have a lot of real-time data in the crisis? How are we going to prioritize and target, both by population and geography, investments that are going to address the biggest gaps? And how do we make sure that when we're planning for recovery, that it's equitable recovery? And for this, we wanted to lean on the best tools available, and the work that Hawaii Data Collaborative has done around population modeling is the tool that has helped us. And I'm going to turn this to Nick Redding of the Hawaii Data Collaborative, who's going to talk about how this data modeling project has helped in COVID planning.
Nick, I'm not getting your sound. Are you on mute? Tom, can you hear me?
I can hear you.
You can. Can you hear Nick?
Nick and I both were can hear Nick now. He was on screen. His screen share.
Yeah, I can see the screen share. I just cannot hear sound from Nick.
Nick, can you check if your microphone is muted on the computer?
I'm going to tell him to try back in. I'm texting him. While I get it, I'll just say that, and I won't do justice, Nick, the Data Collaborative. It was a project just started a few years ago. It was intended to collect, analyze, produce data around the well-being in Hawaii, community well-being. That mission is based on how a community. Nick and his team started collecting data much like a CARES project or a neighborhood indicator. Smaller state of 1.4 million. So this data is a little easier than most state functions. Nick, I just started producing the Data Collaborative while you connected. You chime.
I can see you, Nick. I just cannot hear you.
Let me do a sound check now.
I can hear you now. Go ahead, please.
Okay.
Thank you.
Yeah, sorry about that. I'll go a little faster to keep everybody on schedule, and I wasn't able to hear what Tom might have said while I was gone. So try screen sharing again. The joys of the new normal that is COVID and presenting. Anyway, I'll skip the introduction to the Hawaii Data Collaborative, but I'll just say that we're a local nonprofit that works on local data challenges through collaborations. You can find us at hawaiidata.org if you want to learn more. Probably what's already been said on many of the discussions today is that we all have these challenges of not necessarily having the data we need or being able to use the data that we have in the ways that meet the demands and complexities of the challenges today. The timely data that we do have requires translation to help us understand how the situation is shifting, and that's led us to see how we can adapt and respond to that emerging gap in our data resources. We've developed something called a synthetic population model for Hawaii. We actually developed it, piloted it before COVID hit, fortunately. And essentially a synthetic population model is a representative data set of all individual households and individuals in the state. We developed it to specifically respond to limitations and census data that we were having locally in terms of insights around Native Hawaiian population and dissatisfaction with how census aggregates the Native Hawaiian communities. And also our state had really taken up the task of confronting the challenge of what are known as ALICE families from the United Way framework. Those families that are not yet in poverty, but are one lost paycheck away or other financial event from falling into poverty. We had a number saying that about half of our families were either in poverty or on the verge. But beyond that, we had very little to work with to understand which communities were struggling more, which demographic groups, et cetera. So we had started to develop the synthetic population. We weren't rushed because we had a timeline that would take us into the year to get the most out of that. But with COVID, we accelerated development to respond to the new challenges. Essentially, a synthetic population is derived from using both American Community Survey tables and public use microsample data. We expand the public use microsample data to a full synthetic population data set that is validated against the American Community Survey tables and has much more granularity geographically than the PUMS data. We can also, in the population synthesis process, fold in additional data sources based on the model theme. So whatever challenges we're working on, we can fold those data in as well. A synthetic population is composed of individuals, and those individuals have an age, a sex, an ethnicity, an education background, et cetera. They're assigned to industries and occupations, and they have healthcare or not. They're assigned to households that have a household income, a household type, mortgage, rent paid, et cetera. And those households are put into a place at the level of census tract. And again, census tracts and demographic categorizations, et cetera, closely match American Community Survey tables as a validation. Where this fits in the overall decision support process is that we have the synthetic population, which in and of itself is useful for the reasons I described for Native Hawaiian groups and being able to get more granular estimates from census data for that population is really important. And then also for the financially struggling families question, we're actually able to assign each household a categorization as ALICE or financially struggling or not, which then opens up all sorts of possibilities for more granular cuts on understanding that challenge. Two other things that we can do with synthetic populations is we can either paint other data sources onto it. So this is something the CDC has done with health metrics and mortality estimates and things like that. We can also carry data sets forward, which is what we did with COVID. We can actually use other data sources to see what the census data would likely look like today, given that the starting point is 2018 census data, which isn't necessarily reflective of Hawaii today. We're able to carry that forward with more timely data sources to derive estimates of current realities. The task we had in working with Tom as a first step, there's many things we'd like to do with the Community Foundation and other groups, but they brought us a very specific question around how can we have good data on unemployment, but what we don't understand as well are those unemployed who are falling through gaps in federal assistance because of the fact that they work in the gig economy and they rely on cash-based work for income. We actually have pretty good unemployment insurance data that is shared in the state. So we've got geography, we've got industry, we've got different kinds of categorical breakdowns. So we were able to paint that on the Hawaii synthetic population and carry that forward to understand the situation today at the household level. And then what we were able to do is to, after imposing that, we were also able to draw on prior research that showed how the different industry categories and other kinds of correlates of participation in the informal gig economy show up in the population. So we were able to work with Tom, work through that research and start to create various assumptions that would be put into the model to extrapolate where and who the participants in the informal economy might be, and then that would allow for different kinds of cuts in the data and the synthetic data for the Community Foundation to be able to build a program strategy for working with those households and families to help them get through those times and address, get beyond the gaps that were the programs that were not available to them. What I'll end on is just say that with the synthetic population, what we situated as decision support, which means we don't aim to ever put any of our own assessments and reports out there. We don't use the synthetic population to run our own kinds of scenarios and then write up reports that we share. We always use it in partnership with other organizations who already have the deep contextual and specific topic expertise. And then we bring the modeling team alongside that to co-develop a model and scenario approach for addressing the questions that they might have. And this shows up in this graph as an iterative process. So we work with a team to develop a policy or program or strategy design. We model that, we report it, and inevitably that leads to further iterations in the model and the program design that we then play out again. And this is an ongoing process based on new questions as they come up. And so we're in the middle of that right now with the Community Foundation and other partners as well. So for the sake of time, I think I'll wrap up there. Thank you very much. Look forward to questions and feel free to reach out, info@hawaiidata.org if you'd like to learn more about our model.
Thank you, Nick. Thank you, Tom. Certainly one of the more methodologically complex approaches that I've seen and very interesting. So we'll look forward to some questions during the Q&A period at 3:45. For the sake of time, since I don't see any questions yet appearing, although I do see one from Susan Brucci that it looks like it'll be good for the larger Q&A discussion. I'll go on to the next presentation just to keep us somewhat on track. So I'm going to go ahead and share my screen and do you see that PowerPoint presentation? No. Let's see here. There we go. Hopefully you see the PowerPoint presentation and you can hear me. Please let me know if you can hear me. Anyone?
We can hear you, but we can't see your presentation.
You cannot see the presentation?
It's loading now.
Okay.
You're good. Yeah, we can see it now. Thank you.
Great, thank you. So my name is Frank Rizzi. I'm with the Central New York Community Foundation, also an academic at Lemoyne College in the sociology department. And what I'll be sharing about is the experiences of the Central New York Community Foundation using community indicators for real-time COVID response. So a lot of the themes that we've been hearing about are themes that I think I'll pick up on a bit. The major themes that I'd like to focus on, though, are that COVID-19 has accelerated three things that are very relevant to using community indicators in our communities. One is indicator awareness, I believe, has been accelerated. Second is the data to action cycle has been accelerated. And third is feedback loops, I think, have been accelerated in some ways. And I'll reflect on each of these and how specifically I've seen this in our case. So let's go on to the first one, indicator awareness. Indicators and community indicator performance management adoption were already increasing. If we look at community indicators used to assess the position and progress of communities' quality of life, and then incorporate those data into governmental and nonprofit decision-making with respect to policy and programs, that had actually been on the rise since the early 2000s. Numerous communities had set goals in such areas as environmental sustainability and educational goals. As just a couple examples, we have one, the work by Powell that was just published in the Community Indicators Best Practices book that the CIC is advertising on the website, A Tale of Three Cities. You see goals related to waste, goals related to food security, as an example. We also saw, many of these in the areas of education, and here you see the Sarasota Teachers Dashboard, data dashboard, and many of these were related to things like the campaign for grade level reading and focusing on grade level reading by third grade. So this idea of setting benchmarks or numerical goals, kind of like we saw earlier with Mendy talking about the earnings gap or the wealth inequality, it was not completely new. What I would like to reflect on is that it seems that COVID-19, however, has increased public attention to the value of such dashboards and using data to make decisions. Many people, I'm sure I was not alone, in actively watching as executive branch leaders, governors, the White House, etc., and even Major League Sports teams pledged to be guided by data. Here you see on the bottom right, you see my local county talking about data in their routine briefings. On the left here, this is the governor of New York, where I am, Governor Cuomo, talking about COVID and using data in a daily press release. I know people even from other states wrote to me and told me they were watching this. So you see this on these levels, but also in places you might not have expected, such as Dr. Tom Mayer of the NFL's Players Union, medical director, saying, we'll go anywhere where the science takes us and nowhere the science doesn't. So more and more people were talking about science, talking about data, and we even saw this, of course, in the White House, right, with these press room briefings. So in essence, I think this accelerated indicator awareness. It was people were seeing this day to day. It was harder for nonprofits to chat with clients, to keep a finger on the pulse of local need as well. So there was also an awareness of them wanting to find indicators to figure out what's going on among their clients. Local funders felt a need to be data-driven and to react to immediate needs quickly. So we, as funders in our community, discussed local poverty data, food data, children without internet access. There was a real desire to use what was available, including such things as local surveys. So a lot of these things we had been focusing on, but awareness had increased. And things such as mentioned, I know Tom mentioned the unemployment. This is food stamps cases. This is family assistance cases. We also looked at things like meal distribution sites, mapping those with poverty rate areas. And then here you see a mapping of students in need of broadband or Wi-Fi, but also in need of computers and the co-occurrence of those to find target high need areas in the community. So these are all examples of data that we look to that were existing to try to help us keep a pulse on what was going on in our communities, not just health, but also the repercussions. Here you see unemployment shooting up. This is a month-to-month unemployment in our community. This is a month-to-month temporary assistance or public benefits. And then here's where, similar to what Tom mentioned earlier. But also there was a push to see what else we could use. And one thing that popped up was a community needs assessment that had been going on, comparing year to year. And of course, you could see some of these needs, such as having a full-time stable job, jumped up in the year 2020. And so we were looking for ways that we could utilize these data sources as well. And you could see actually, looking to be more responsive, we changed this so that these would be monthly. So here's that full-time stable job, January through August of this year. Please pay no attention to August. We're only 5 days in. But you could sort of see this trying to use any data that was, to get to Susan Bruschi's question, which we'll get to later, the sense of what's happening since COVID, right? The whole world has changed, and you can really see something like unemployment really changing since April, May, June, etc. So there was a sense of greater awareness. Let's look to these indicators because we really can't talk to our clients like we used to, and really can't have that kind of a finger on the pulse. Also, what accelerated was the data to action cycle, right? So what we do with those data. This, of course, is the scientific method. And, due to how much has been hanging in the balance, lives and livelihoods, it's been, we've really stressed taking action and not moving too soon, but also not taking too long. We see this in science itself. A scientist's race, this is a quote from New York Times, to understand the coronavirus, the process of designing experiments, collecting data, and submitting studies to journals for expert review is being compressed drastically. What typically takes many months is happening in weeks, even as some journals are receiving double their normal number of submissions. So we see this in science and the scientific method itself, but we also see this in government, right? It has condensed the time frame and expectations that government takes data to action. So historically, it wasn't uncommon for health departments to notice an upward trend in something like chlamydia over the course of a year, and it would take a few years to develop a response, or a year at least to respond. Now there was an expectation for government action and philanthropic action, I would say, for local funders like us, to take quick action, daily or weekly decisions. And you see this illustrated with the Johns Hopkins. This is now that famous dashboard. Other people started to emulate that as well. And so just to give you an example, if I could get my slide, this is our community's health assessment that was put out. Notice the years are 2019 to 2021. It's several years pulled together, which is not uncommon, as several of our presenters have shared. But you're looking at things from year to year. And let me just give you an example. Here is chlamydia being tracked year to year. But I mentioned this is the 2019 to 2021 report. Notice the data are back to pool data from 2014 to 2016. So that was the speed at which communities tracked indicators and tried to take corrective action. There was always a delay and a lag, and it was always over a longer period of time. However, look at the county now. The county now tracking COVID cases on a day-by-day and month-by-month basis. This was just from a few months ago, and then this was more recently. You can see there's an actual date, April to August, right? So this is a hyper speed for community indicators, and not only for tracking of the data, but the accelerating data to action. As you know from the news, local governments were making quick decisions about whether to open or close golf courses, whether to shut down bars, etc. And those were week to week decisions, much different from the historical time period that we in our field would take to make decisions about things like chlamydia. So it accelerated this data to action cycle also for funders. Here's our example, our COVID Community Support Fund. We pulled together funds and partnership with 12 different organizations, and we pooled money. We built an online platform that integrated community data, and we met basically weekly to consider grant requests rather than a typical quarterly process as per oftentimes you see in community foundations. So we also routinely monitored data to discern what types of needs existed and what needed to be addressed, with an understanding that needs would change as the pandemic went through phases. For instance, first you need maybe food and personal protective, and then technology, and then maybe housing and jobs perhaps as the freeze starts to thaw. We also started to track things. This is that life needs assessment, asking about, for instance, food needs. And you can see even our dashboard started to emulate the typical things that you see at the Johns Hopkins and the county dashboard, where you could see even day to day, month to month, food reported food need, and you could also track it by neighborhood. So we use census tracts, and so you could really see this is July. Don't pay no attention to August. It's so new, but really monitoring food need. So the sense of data being not only expedited, but also response. We moved to a real-time tracking of our grants. So this fund that I mentioned earlier, we were actually really real-time tracking how we were making grants. And so in March versus April, May, June, and July, of course, pay no attention to August. We haven't added those grants yet, but you could see things changing, such as food grants. We started out very heavily focusing on food and then moving down. And all of this wasn't, not the old style report that you see in the former health type reports, but it was a real-time tracking. So we could see what we were funding. And so what I'd like to suggest is this also has really pushed us forward and offers an opportunity for feedback loops with this entire expedited or accelerated life cycle of indicators and data to action. So what I'd like to close with is just this tour of how feedback loops have actually improved in our community. Historically, when you talk about surveys, you see what we tend to see on the left here with individuals filling out surveys, and those go to organizations, and then they do something about it. But what we've actually seen accelerate is a full life cycle where those organizations then are able to share and do cross-organizational collaboration based on shared data. That goes up to inform funders here, place-based funders. And then the funders then have a feedback loop which goes back to nonprofits, which they can then pass back to individuals in a way to be connected in a day and age where we really can't see people face to face. And many people have shared that they're really flying blind as this, flying by our instrumentation or flying by our data rather than talking to people individually. So starting with that first step, that takes place, moving to apps, and most of this was done in using phone apps or internet surveys, but asking questions like, do you have long-term housing you can afford? Do you feel safe? Do you have enough food? Basic needs that are, of course, important. Bring it to the fore the importance of flying by the instrument panel. We saw a 40% increase in use of this survey this year. You can so far, and this year is only half over from last year. And so more and more organizations saying, we need to really know what's going on in among our clients. So that really certainly increased the usage from individuals reporting to clients on the survey. And when it gets to organizations, here's one example of our local community action partnership, which used this same survey to then go ahead and publish what they saw as the biggest needs in the community among their clients. But it also engendered a greater opportunity because the more organizations started sharing their data in a platform, and you could see this highlighted in an app that we built, what basically takes the data and allows organizations to reach out to other organizations to partner. So here's one example. You can pull up by month. This is May, June, July. For instance, and you can find how many people said they did not have food at each of these different organizations down the left side. So as a way to partner and reach out and make sure that organizations that were connected with people who needed food were able to, you could reach out to them and connect them with organizations that were providing food, as one example. Another one is another version of that same thing by geography, by neighborhood, as our keynote and others have mentioned. Neighborhoods are very important. So then moving to that next phase, the funders were able to see this, and as you typically expect with a funding and community outcome relationship, this is one that I just took off of from a paper, academic paper. But here you see a relationship that as public health expenditures increase along the x-axis, you should see infant mortality decrease, right? And you see that with many things on international studies. Well, what we noticed too was when our percent of grant funding on food increased, we also saw a similar relationship in that a lower percentage of people were saying they needed food, right? So in a sense, hopefully you're funding and making that need go away. So how does this translate into flying by our instrumentation? Here you see something that we had never done before, the pairing of this is community need polling, as many of you have mentioned, polling in Tower and other foundation. This is a month-to-month poll. Each month doesn't have a tremendous number, maybe 200 to 300 survey respondents, but you could see that we were able to track and make and use the need, and at the same time track our grant making in that area. So the idea here is that if we make a lot of grant making in this area, it will hopefully suppress the need and keep it down. And what you can kind of see here is that we really did focus, on, as this started to trickle up, right? This is the need for safety, right? We funding went up and started to sort of push that back down and keep it manageable. We did focus on things like food and personal safety more than we were able to focus on things like housing, with things like the freeze on evictions. But also other things like being able to pay bills. These things, we both provided less funding, and you could see that the needs are at least double in those areas. And so it's a way to sort of match need with also funding and response. And so just to finish up, the closing the loop of the funders back to organizations, we're able to build out a real-time tool where those organizations could pull up funding decisions made by either area or neighborhood or both, and pull up a list of what we were funding in those areas. And then to close the loop, they were able to then pull up a list of clients, either by neighborhood or need or both, and reach out to those clients to let them know that we had funded things. So really, in a similar way to the texting key neighborhoods, we were able to start to close the loop with local residents. So in conclusion, COVID-19 has really accelerated indicator awareness, data to action cycle for us, and new opportunities for feedback loops that hopefully will help us to build back better than we were before. So with that, I'm going to close and sign off, stop sharing, and we'll transition to our next presenter, Catherine Pettit. And we're making fairly good time. We're about 9 minutes behind schedule, and we will catch up to that with the Q&A session. So Catherine, are you there? Can anyone hear me?
Yes.
Great, thank you. Okay, so I'm not seeing any questions yet. So please feel free to post those, since right after Catherine's presentation, we have an opportunity for Q&A for any of the most recent presentations, but also if you have any for the entire place-based funders track. So there's a lot of synergies here and a lot of recurring themes.
Catherine, you need to allow the browser to access your computer. That's what the problem is. So if you go back, continue. When you
if I turned it on.
There you go. Yep, we can hear you now.
Excellent.
You can turn your camera on. Yes. Okay. If you can just get the microphone. Oh.
There it goes. Can you still hear me?
Yes, we can see you and we can hear you. You just need to put your presentation in presentation mode.
Excellent. I've been watching everybody else struggle. Can you see it?
Yes. We can see it.
Fabulous. Thank you. Thank you, everyone, for being patient. And I know that I'm the last presentation of the day, so I am happy to be going before we can launch into the Q&A, and have been inspired by the other presentations. My name is Kathy Pettit. I'm a researcher at the Urban Institute and co-director of the National Neighborhood Indicators Partnership. NNIP is a learning network which connects partner organizations across 30 cities. All of our partners make sure that their communities have access to both data and the skills to use the information to advance equity and well-being across neighborhoods. And I'm excited today to share insights from our brand new brief on investing in data capacity for community change. It's going to take it up a level, I think, from the great examples we've heard this afternoon. The project, I will also thank the Robert Wood Johnson Foundation for funding the project. So I think the examples from the presentations today have shown that there's sort of more and more data available, and there's a really great hunger at the local level to use the data to make progress. But what we've really seen from our experiences around the country, that many places still lack the skills and resources to put that data to use, to really set the goals and improve the lives of the people who live there. And we saw this difference, I think Frank mentioned, in the differential of how fast communities were able to respond to COVID-19 and that emergency with data. Places with strong data capacity could get a huge jump start in indices and tracking the very same week that things were exploding, while others took longer to get started. So there's a lot of pieces to solve this problem, but we think that foundations have a really special role to play in enhancing a community's ability to achieve change with data, not just through their own use of data, but for their whole community. This is both because obviously foundations have resources, which we all know, but more importantly, the goals are really aligned for making progress towards more equitable outcomes, and we think data is a tool to get there. So for today's presentation, I just want to talk a little bit about what community data capacity is, recommend big ways that foundations can enhance that where they're working, and then share 3 examples from the field of where this is already happening. So community data capacity is not a flood of data from a data portal or only the dashboard. It's more like what Frank just illustrated, sort of both having the data, figuring out what you need to learn, asking the right questions, putting it into use. And that it's, we really believe that this capacity should be held across institutional sectors. So you need a good government, you need smart nonprofits, you need well-informed philanthropy, but this also is should be a capacity that's held by the people who live in a place to make real progress on hard problems together. So any efforts to use data or improve data, the improved data capacity has to be really firmly rooted in a set of values upfront for a couple of reasons. One is that people have used and continue to use data to harm people of color, and a lot of the neighborhoods that people have been trying to help have been talking about helping all afternoon. So there's a real reasonable mistrust of having data used against them that we need to work against and think about how it can be used to benefit people. I think the second reason is that even when data are not intentionally used to harm, they are often created and analyzed by data professionals. So the people most affected by the issues, like I can go look at an ACS table, but I may not actually understand the root causes of why somebody is food insecure or has health vulnerabilities. And they really need, we really need to push down the ability to both access the data and build the skills to advocate for change. We have a companion brief to the Invest Data Capacity one on principles of equitable data use that there's a link to that I encourage you to take a look at. So we kept hearing people, national foundations, national organizations, especially, or other funders saying either collaborative just wasn't good at data, or organization, they're just not good at using data. So we really wanted to pull apart what that meant, the many elements of what it takes for a community to use data, so places can begin to assess where they are strong and figure out where there are gaps, ideally not always in an emergency situation like we are now. So the first set is the obvious set that's enabling resources. So the great dashboards we've seen today, and then also the help with data, the technical assistance or training that people are getting to use the data are both a sort of wrapper resources that we think are necessary. But the second set is a set of skills and practices at these different levels. Frank, I liked your graphic. It echoed my framework too. Not everyone needs to have every capacity. So for example, in technical expertise, you don't need everyone in a community to know how to load data into R and run the regression or do that fancy modeling that Nick talked about. You do need some of them, but you do want everyone to have confidence with data. You want people in the neighborhoods to be able to look at the COVID dashboards and be able to interpret it and make decisions about how they're going to behave and query it. What questions do you have? Who's missing from the data? Who's not getting tested? Those kinds of things. At the organizational level, it's both formal, like data governance and performance management, the things we think about, but also a culture of curiosity and just not thinking of data as punitive or being afraid you're going to get your funding pulled because of data. So it's as much of a value statement about how data can be used to advance the mission. And then the collective, Frank did a great job of giving a little illustration about what collective data capacity looks like. So that's learning communities across organizations, sharing data across places, and really planning for gaps in data. Like we heard, Oklahoma or some of the individual level surveys, we heard identifying gaps in data that everybody needed. So there's about 12 of them. You can read all about them in the brief. So we have 3 big ways that funders can contribute. So I think there's been many demonstrations of funders using data in smart ways to make grant making. This is broader. So first, I think is the most common, to promote the use of data by grantees. The second, to really do the promotional work of evangelizing community data to other organizations and your peer funders. And then finally, to invest directly in building community-wide data capacity. And I think we've seen today in the presentations, grants are important, the funding is important, but the influence that foundations, and especially place-based foundations, the trust that they have, the convening power, the communications are as important as the funding. So in my first example about helping data for grantees, I feature this previous CIC Impact Award winner, Communities Count. And I think it's been mentioned here about trying how larger established nonprofits, sort of the usual suspects, generally have more experience in using data, and it gives them an advantage in competitions for funding. And it can perpetuate the inequities that harm organizations led by and serving people of color and other marginalized groups. And in Seattle, our partners, staff members at Community Counts wanted to see how this data disparities were impacting the outcomes for one of their grant programs. So they analyzed a set of grants from a program called Communities of Opportunity that some of you might have heard of, a place-based initiative. And in their analysis saw that every grant that won used data effectively, but only 40% of the group that didn't win used data effectively. The unfunded proposals also were often seeking to support new emerging issues or different kinds of groups like the Somali refugees, LGBTQ communities, but they couldn't connect the data or the need to articulate it to their project for the funding in the written proposal. So our community account staff reached out to groups that had not won the grant and offered training on data, how to tell their stories so that they would be better positioned for the next round. But even more important, they started to proactively offer the training to prospective grantees. So now the support for using data in applications to the program starts at the bidding conference and then continues through the application process. And this encourages both a better quality set of proposals, but also, a more diverse set of proposals that reflect their community. The second way I described was the championing in one of my favorite cities, Milwaukee. Here, several cities around the country organize annual gatherings to highlight how data can improve neighborhoods. And Milwaukee's been holding their data days since 2015. Our partner Data You Can Use in Milwaukee gathers about 100 people from government agencies, civic tech, academia, data science groups, and people from neighborhood organizations to talk about, network, discuss how data can be used to help their neighborhoods and the successes they've had in the past year. And this is made possible by several local foundations that have been really committed to funding the event over the past few years. You can see the activities you'd expect, both presentations, networking, the poster sessions you see here, really letting community groups shine and share how data has improved their work. They also have a data dream competition where volunteer neighborhood groups, churches, have a pitch contest to be able to win $5,000 in services for collecting and analyzing data to meet a neighborhood's needs. And these are often very small groups, either a neighborhood group supporting the environment or a group, mothers group working to end gun violence. That gives them that allows them to keep going and get extra expertise in the community. And then for the final example, in 2018, many Hartford youth serving organizations wanted to improve their services by sharing and integrated the data that they had with educational outcomes for the youth in their program. So they had kids in tutoring or mentoring, but they weren't sure holistically how these kids were doing or making progress based on the program work. And they were having a really hard time making any progress on this goal. The Hartford Community Foundation commissioned an in-depth assessment of the needs and barriers to data sharing and integration. And I've heard the questions that people have asked about acquiring proprietary data or confidential data shows how challenging this is for one-off solutions for this. The assessment found the challenges that you'd expect. Legal, that, how does it fall into federal restrictions on using the data? Political, just having a school official say no for no particular reason. And then the technical, actually, pulling the data down and doing the linking. In response to the findings, it was a public findings that the consultant shared with everyone. Several local funders supported the development of the Hartford Data Collaborative, which they're developing a shared client-level data infrastructure citywide so that all the players can get timely, integrated, and accessible data in a responsible way, continuing to protect the privacy of the youth that they are serving. And this is both serving on the operational side, sort of case management and services, as well as policy research evaluation. We were so excited by this example because it really is a community level intervention rather than solving, okay, I'm going to allow this organization to share this data one time, really coming up with the infrastructure to break down barriers for many organizations at once and have them get deeper into using the data rather than just struggling to get to access it. So we wrote this brief in hopes that program officers use it to advocate, and we see more deliberate and consistent and coordinated efforts to increase data capacity in communities, but also the community organizations and data services and analysts friends I see on the participant list can use the brief to make the case for their own funders that more money can go into the capacity building so that we are better able to respond to both new emergencies like COVID. We know that data can be a powerful tool to understand the community, set goals, take action like we've heard about this afternoon, but this power really must be shared throughout the communities to both address the current hardships and Angela said, started us off today to help guide us to a more equitable recovery. So there is our website where you can find the brief. We are launching an expanded site on Monday, which has these 3 stories plus about a dozen others about how this is happening in the field, along with some resource lists. And then here's general information about how to reach us at NNIP.
Thank you, Catherine. Thank you. It's so helpful to see the work you're doing to build capacity in communities to do this type of work. You know, as we see, and as you mentioned several times, having the capacity sets you up to succeed when the next incident arises, right? And we're talking about COVID-19, but several of our other presenters talked about, Hawaii. They had been affected by a few already, and earlier, another presenter shared that there were a few issues already that year. So this is really important work.
Or the everyday crises of persistent poverty and fighting racism and all of the other challenges that the communities faced before COVID hit.
Yeah, which have all been exacerbated by it. Thank you. I'm mindful that there's time. At 4 o'clock, the next session is starting. If anyone wants to squeeze in a question really quickly, though, please unmute and jump in. We do have a question from Susan Brucci. I think to Catherine and to everyone, this was asked earlier. It's very interesting to see how we are referencing our community data collected recently, but still prior to COVID. How do we honor that, and yet also that the whole world of well-being has changed? So I don't know if you want to respond to that, Catherine, or if anyone else would like to.
Sure. I mean, I think this is where it's even more important to obviously gather stories from the field, but there's more innovative work happening. For example, my colleague, Graham McDonald at Urban has modeling public open data. We have job loss that we update every couple of weeks at the track level. So I think the modeling work that Nick's doing and the FAST survey work that Frank, I saw your cell phone surveys are going to be really important as we, as we go forward. But a lot of the things have not changed. I think if you look at rent burden, that was really high beforehand. So, I mean, I wouldn't throw it all out the window, but thinking about what the wrappers are that we need to figure out is really important.
Thank you. Thank you. Thanks to you, Catherine, and thanks to all of our presenters and all of our participants. This has really been a rewarding panel session track for me to hear what everyone's doing. And please feel free to follow up, and we will have time throughout the conference to touch base with others. So I do want to encourage everyone to go on to the 4 o'clock session. We have a whole nother track